So basically, Darlene, you're here today. How many days after your surgery?
Let's see, Wednesday, Thursday, Friday, Saturday, Sunday, Monday,
5 days, right? And you came to me referred by a nurse practitioner who works at your spine doctor's office, right? And we're not going to name any names because obviously it's a video, but you have a very interesting story because you just mentioned to me a couple of minutes ago that you've had epidurals for this condition, you've had spine injections, probably. Well, what else have you had for this?
Mainly spine.
Spine injections.
Yeah. I thought everything was coming out of the spine thing.
Which is common assumption,
Yeah,
right? Sure. But it's interesting enough that it's actually the PA, the nurse practitioner at the neurology and neurosurgery clinic that where you went, that picked up that it's not your spine, but it's common peroneal nerve, which is the nerve in your leg, right?
I don't know if they caught it or if you caught it.
Well, they referred specifically for this.
Oh, for this, so it must have been.
So it's,
right.
it's Julie who picked it up.
Right.
And basically, your test actually showed that there was a compression of common peroneal nerve. So when you came to me, I told you that, remember how we did that test where I block you? Because that's, we always do that. And then I even send you for a second opinion to see doctor in Orlando, just to be sure that we're not making that stuff up.
Right.
And he confirmed that this is a common peroneal nerve entrapment. And then we decided to go ahead and go with surgery, where I went in 5 days ago and I decompressed the nerve in your leg. And I'm going to take a camera and kind of show where your incision is. So this is your incision. It's right below the knee. And I will mention something. When I walked out of the operating room and I talked to you, and I'm not sure if you remembered it, but I asked you if you had any pain, and you said, what pain, right? So was it like an instant relief of pain? I mean, how long did it take for the procedure to fully work?
I really couldn't tell.
But do you have any pain right now?
No, I haven't had any.
So procedure worked, right?
Yeah, since the surgery,
Yes, so, well, the reason why I'm doing this video testimony is because it's remarkable how correct diagnosis can make such a huge difference, right?
Yes.
So, because, we thought it was coming from your back, and it's a very, very common condition called sciatica.
Yeah, that's what I've had.
Right, but basically you had a specific compression of the common peroneal nerve, and that relief of the adhesions gave you that instant relief of pain. So guess what? We're going to start the lasers today. You're going to get some instructions how to do dressing changes, and I will see you back in 10 days and we will remove the stitches, and that will be it.
That'll be it.
So good job.
Yeah, good job for you.